Hi, this is Dr. Gary Sykes, and what I'd like to discuss in this vlog is financially planning for your pregnancy as a private patient. It's a rather complex question because you get bills coming in from multiple sources, so it does get quite confusing. So I'll try and keep it as simple as possible, and it's only going to be talking about the usual scenario. So the first consideration is, are you in a private health fund that covers your pregnancy? If you are, that's great. If you're not, then there will be more expense for you. Okay, the next is obstetricians are self-employed. Therefore, our bills vary, our billing system varies. So what I'm going to talk about is what we do. I'm not going to talk about what other doctors do, just what we do. So the first, we start with your first antenatal visit. So you come along and there will be a bill to pay. There'll be a part that Medicare will reimburse you and a part out of pocket. Then we have the subsequent antenatal visits. We bulk bill you. What that means is there's nothing to pay at all, irrespective of how many, of how few there are, irrespective of how long they take, irrespective of whether there are extra emergency visits between your routine. We don't charge you anything. We get reimbursed by Medicare. At each of these visits, we do an ultrasound scan of your baby. We don't charge you for that. Indeed, I don't even get reimbursed by Medicare for that. That's totally free. We give you a USB at your first visit to store the images on. Then we move on to pathology. With pathology, we encourage bulk billing. There will be no bulk billing there for the NRPT because there's no Medicare rebate, so that's out of pocket. Then we've got the ultrasound scans. With the ultrasound scans, there'll be at least one external scan. I encourage it to be done by a specialist pregnancy ultrasound unit. So there'll be a part that you reimburse by Medicare and a part out of pocket. Some patients elect to go to a bulk billing radiology practice. Now that's free, but the trade-off is they're not specialised in doing detailed pregnancy ultrasound scans of babies, so there is the risk that they may miss an abnormality, which could have huge implications. So moving forward, we've got the management fee. This is paid during the course of the pregnancy. There's a part you'll be reimbursed by Medicare and the rest is out of pocket. Because it is more significant, we encourage patients to pay it in 2 instalments. Then in the pregnancy there could be complications. For instance, you could have diabetes, and I'll refer you to an endocrinologist. There'll be a part that you'll have to pay on top of, and a part Medicare reimburse you for those visits. Moving forward, we come in to have our baby. If you are in a health fund, this will be reimbursed by your health fund. The health fund will pay, except for the excess, if there is an excess to pay. If you're not in a health fund, then you'll have to pay the hospital bill yourself. Now, Norway's private hospital has a 2-night stay and 5-night stay packages, and so you can pay up front for that, and they're proved extremely popular, and that's based on the typical labour delivery scenario, but there may be variations from that, so there may be an out-of-pocket expense, but it usually works extremely well and patients are happy with it. So you come in, you have your baby, there'll be other doctors involved in your care, there'll be a paediatrician who checks your baby. There'll be a bill there, so there'll be a part that Medicare pays, a part that your health fund pays, and there'll be a part that you have to pay yourself. If you have an epidural or need a cesarean section, there'll be the anaesthetist. There'll be a part that Medicare pays, a part your health fund pays, and a part that you'll be out of pocket. Surgical assistant, the same if you have a cesarean section. Part Medicare pays, part your health fund pays, and a part out of pocket. For us, there's nothing out of pocket. So irrespective of how complicated your delivery is, whether or not singleton or twins, cesarean sections, delivery complications, whatever, we don't charge you anything out of pocket. So we get reimbursed by your health fund and Medicare totally. Moving forward, you've got your postnatal visit. We take what Medicare gives us, so you bulk bill for that, so there's nothing out of pocket at all. So I hope that summary helps. As I said, I'm going to put up a spreadsheet now so you can see it visually and maybe able to copy it. And also I'll do an article on it on my website too, a blog article. And I look forward to speaking to you again soon. Bye for now.